Dear viewers, friends from home and abroad, my heartfelt congratulations and greetings to all of you to this episode. Myself, Habibur Rahman, with the platform Community Talks. On the topic, practice setting up professional social work in the post-COVID, post-Soviet countries, with six eminent social workers, social work practitioners from Russia and other three countries. So they will join us soon. Please be with us and put your valuable comments, share it right now, and let other friends to join us. So by the grace of Almighty, we are again with you with this Community Talks 28th episode. This is really very exciting day in terms of community work and social work. So we are with you regularly with different guests from different countries on COVID issues and the practice of social work in different corner of the world. So let me introduce with distinguished guests from different countries. We could see Alena from Belarus. Hello, Alena. How are you?
Hello.
Antonina. Hello, Antonina. How are you?
Very well, thank you.
Thank you. Hi, Omeda. How are you?
Fine, thank you.
Thank you. We can see Anton and Ekaterina from. Hello, Anton. How are you?
Hi.
Hello.
Hello. We are fine.
Friends, all right. Actually, I'm very excited to see all of you here today. You are very busy, but you just accept my invitation to join this community talks. Let me say a few words about this platform. At the very beginning of COVID, I just thought as a social worker in Bangladesh, what can I do? As WHO and Ministry of Health declaring that we should keep physical distancing, even IFSW, IASSW simultaneously declared through the social work forums that we should keep physical distancing, we should stay home, try to stay healthy at home. So that time I just started thinking as a social worker, what alternative I can do really. I just thought and started this platform, Community Talks, and you will be very happy. This is uh, this is 28th episode, right? And this is completely a global platform. Yesterday, we had a session with Honorable Senior Secretary, Ministry of Social Welfare, the People's Republic of Bangladesh, and Honorable Pro Vice Chancellor. He is an ex-professor of social work of Dhaka University. Actually, they are policy level people. And on 20th, I've invited Honorable State Minister, Ministry of Social Welfare. Actually, my journey is coming to close to the not end to the begin of social work journey, professionalization, orientation among the community and mass people, rather than only academy and academics. So I have been inviting so many other friends from different countries just to get their thoughts together. I thought this is kind of virtual archive on community work and social work. It might be, actually, it's my thought, initial thought, as I have been getting voices from different parts. And today is very special. I'm very happy to have you all together. I know you are very busy, especially Antonina, Honorable President of Russian Federation or Union of Social Workers. She is very busy. I'm honored to have you, Antonina, with me, and other friends like Alena from Belarus, Anton and Ekaterina, Omeda, all are actually busy but sacrificed and dedicated their 2 hours for me, for Bangladeshi people and other friends from other countries. So let's come to the point. As the time COVID, this time, this is a very suffocating time for all, everywhere in the world. This is called global pandemic. This is called social pandemic. This is called economic disaster. Lastly, it's called
Some problem.
Still. there might be some connection problems with Habibur, I guess. We can.
No, it's okay. It's okay. I'm very sorry because currently I'm out of city where actually I've been residing, but I'm out of Dhaka city. So I'm using my mobile phone with laptop. When phone call comes here, it automatically gets off. It's come again after that. It might create some problem, but it can create some problem. So let's come to gradually we can share some feelings face by face basis. So I love to listen voice from Umeda, Tajikistan, Honorable Executive Director. Umeda, Honorable Training Coordinator, Caritas, Germany in Tajikistan. Umeda, I'm very honored to have you here. Could you please share within 2 or 3 minutes during this COVID time how you are in family, in community, and even in office? Just sharing first 2 or 3 minutes. Umeda.
Thank you very much. But I need to translate. Can you help me with translate?
Он попросил в течение 3 минут рассказать в целом, в общем, ситуацию, какая в Таджикистане, вот, связанная с ковидом, что происходит, как вы справляетесь с этим.
Понятно. Но вот мне нужно будет помочь с переводом.
Okay.
Екатерина, сможете, да? Ой, спасибо.
I will try. I will try to help with translation.
Okay. Thank you very much. COVID в Таджикистане был объявлен в конце апреля, хотя случаи заражения уже фиксировались в марте.
So COVID situation was announced in late April in Tajikistan, although the disease appeared already in March.
Правительство Таджикистана приняло решение не вводить карантинные меры, а вводить только ограничительные меры.
The Tajikistan government decided not to apply quarantine, but to apply only limitation measures.
Все ограничительные меры носили рекомендательный характер, и в связи с этим ситуация эпидемиологическая в начале вспышки была очень критическая.
All the measures that were applied were just recommended. That's why the COVID situation at the very beginning was very acute, very harsh.
Но, несмотря на это, социальные службы приняли экстренные меры, не дожидаясь карантинных мер, и перешли на режим ограничения, строгого ограничения, особенно в закрытых учреждениях, в институциональных учреждениях.
But social residential institutions did not wait for the quarantine measures, and they decided to close up, to close up and to limit any visits at those institutions.
Так как в нашей стране изначально система здравоохранения была не на очень высоком уровне, нам пришлось больше надеяться на собственные силы. Особенно это касается социальных учреждений, где очень большое количество людей находятся в закрытом учреждении и имеют ограниченный доступ к медицинским услугам.
Tajikistan healthcare system is not at the level that we would like it to be. That's why social institutions have to decide for themselves, have to apply or take decisions themselves.
В связи с этим эти учреждения закрылись, социальные работники закрылись вместе с клиентами на протяжении 2 месяцев. с интервалами 1 месяц. То есть вот одна группа социальных работников 1 месяц закрылась, потом вышла и на 2-й месяц закрылась другая группа социальных работников.
So the social workers decided, or actually they used the shifts method when one group of personnel, one group of staff just closed up with the residents of the institutions for 1 month, and then in 1 month another group substituted them. Amanda? Amanda?
Anything else, Amanda? All right. Thank you. Thank you, Amanda. We'll come again to you to just listen more from your side, from Tajikistan. Let's come to something from Anton and Ekaterina from Russian voice within 2 or 3 minutes. How you are during these days over the weeks and the days during COVID in home and offices. Actually, in new normal situation, life is not normal in that way. Anton and Eka, please.
You first? All right.
You can start.
Okay. It's really difficult to speak English. We can see our friends from other post-Soviet countries. Hello. In Moscow, we have some problems too with COVID-19, and we take shift method too in our stationary institutions, right? Residential.
Yes.
Yeah. We take 2 groups of our specialists. One group in first 14 period time, yeah, and other group, another group. The most most difficult period was the second part of money. Now we have a good dynamic. We have no more new people. We went second wave of of COVID, but I think we can't. We can do something. Katerina?
Yes. So Anton was actually living with in his residential home together with his staff. Like he was doing also shifts, 2 weeks, yes, the place, and then taking 2 shifts probably at home. And well, for us, I'm working at the Institute for long-term education of social workers, and for us normal office people, this period was mostly a period of shifting duties. So we were moved to the departments, other city departments where help was needed. Like, for example, I myself worked in the call center, getting calls and directing people who were arriving from abroad. So they had to take sick notes and stay at home distance for 14 days. So it was a huge wave of people, and it was done quite well. So people could not, should not have gone out for 2 weeks and stay on quarantine. Also, I've been working at the city government where already the critical situations were being solved. And at that time, there were some difficult calls, like you would call a family where people would die from COVID. And yes, there was some psychological pressure from that. Well, we are working in offices starting June 15th. So that was already the release of measures in Moscow. And I think we are already on the 3rd yes, on the third wave of release of measures. So all the sports centers are open right now, and the playgrounds are open. We're still restricted to wear masks and gloves, but it's not obligatory, in fact, right? So some people think they should, some people would not. Well, at least I have never been punished for not wearing gloves. It's quite difficult to wear gloves in summer when it's already hot. It's difficult to wear masks in such heat. I think people are quite relaxed right now, and I really hope that it won't cause any other problems in the future. I hope, yes, that by September children will go to school normally and the work will proceed in a normal way.
Okay, thank you. Dear viewers, let me actually introduce Anton. Mr. Anton is the Honorable Director of Moscow State of Psycho-Neurological Institute, Russia, and Ekaterina, she is the Head of International Relations, Department of Moscow Social Welfare Institute. Actually, we are very honored to have you here. Let's come to Alena. Alena from Belarus. She is Honorable Executive Director, MGO Belarusian Association of Social Workers. So, Alena, could you hear me?
Yes.
So,
yeah.
Could you please share some voices from your areas, right, how you were at home and office, and how you were passing this time, COVID-19, as your first inception talk? Yeah.
Okay. First of all, I would like to say that I'm really glad to see all my colleagues from different countries. And if to say about COVID situation in Belarus, it was a little bit strange because we didn't have a quarantine and we didn't have any strict measures at the governmental level. But at the same time, if we are talking about social institutions and social organizations, they faced a really big challenge in this situation because they have had to decide about the security of clients and people they provide services, and so that's why most of the governmental organizations and non-governmental organizations, they decided to close their organization and to keep their clients in safe. That's why most of clients were provided services at home. And lots of organizations, they started to work from home and with using online services and so on. Now it's the situation changed a little bit, but we still still have some kind of measures in closed institutions. They are still closed for entrance. Nobody can enter the closed institutions, but some of social services, they are provided as usual starting from July. So I would rather say that the situation is a little bit coming to a normal as usual in Belarus right now.
Thank you. Thank you, Elena, for your nice deliberation inception talk. Actually, situation getting better in some countries. And in Bangladesh, situation is as usual. Actually, it's not getting better. It's not getting worse. Every day, daily death toll is around 50, more than, 50, like 53, 4, 5, or below 50, like 40, 38, as usual. And positive cases within 3,000 daily, but matter is people are not aware. Government is trying to announce, government is trying to aware people, but people are becoming used to, accustomed to maintaining that this is very normal. It's normal case. It might be happen. So nothing to be worried, nothing to be bored. Few people, those who are educated and self-cautious, they don't love to come outside, but as hospitals is open, market is open, other shopping malls are open nowadays, transport is open, so people are coming sometime, and Governments are open, so it's very rational in that case. People might be a bit pressed in that case that they need to come out of home, but safety measures actually they should maintain. That government is imposing always. Government is trying to aware people. So let's come to our honorable president of Russia Union of Social Workers and Social Pedagogists and honorable chief of Social Work magazine, Antonina. Please unmute. Hussein, unmute.
Right? Yeah.
Yeah.
Hello.
How are
Hello.
you?
First of all, dear Habibur, thank you very much for your initiative and for this wonderful organization. And thank you for taking advice from all the people like me to bring together a representative from post-Soviet Union countries. I would like to say, I will say a couple of words about COVID-19 from the all Russian perspective, and I will give some important information, I think. But I would like to say that Russia has a social work as well as everybody other countries do, but our situation is slightly different because, as you know, Russia is very, very big country. And just to say that to fly from one part of the country to another takes 8 hours, 9 hours by plane. And we have 8 time zones, and we have 150 nationalities, meaning that there are people of different nations live in my country, and they speak different languages, and they have different beautiful clothing, they have different cuisine, and they have slightly different social work, not approaches, not values, but problems which occur according to the place where they live. We also are a country where we have 85 subjects of Russian Federation. Among those, we have Muslim subjects, regions. We have Buddhist regions. There are 3 Buddhist regions in Russia, and of course, their traditions will be slightly different. So when we talk about Russia, it's particularly difficult because of its vast distances and a lot of differences in climate and nation and so on. That's why Union of Social Workers, which I am responsible for, or which I am president of, we have to work with everybody. It means that talking about COVID-19, I can tell you that every day I am in touch with different regions of Russia, beginning from the Far East, Vladivostok, Khabarovsk now as well. So different areas than in Siberia. And we monitor and have the situation, we know the situation in different subjects and what are the problems of social workers. Of course, in all institutions, with all elder people, with all disabled people, social workers continue to work. But in Russia, because we are members of International Federation of Social Workers, we were looking around. And for instance, we knew that Korea Association of Social Workers, they were the first to start isolate social worker with clients. Russia did it as well a little bit later, but it was a very successful measure. We looked at a Romanian Association of Social Workers, for instance, and we know that they were really pushing very hard for their governments to make equally important professions of doctors and social workers. And we were doing the same. From our Union of Social Workers, we were writing letters to President of Russian Federation, Vladimir Putin, telling their conditions and situation and difficulties of social services and social workers. And we managed to get the result. And the result was that each social worker, which was locked down with clients for 2 weeks, will get additional money. It's approximately $500 extra to the person's usual salary. So it was a big achievement, and it was a big achievement that president of our country was applying to us, talking to social workers, telling that country appreciates all our efforts. But I suggested to you, Habibur, to bring ex-Soviet countries. We don't usually call ourselves ex-Soviet countries, although we are. And one, the most fantastic thing for me is that we know each other, we love each other, we speak Russian language, although each of them have their own languages, but we also have a language which brings us together, and which I hope that Tajikistan, Belarus, Moldova like it as well as we do. So we like to work with the World Associations of Social Workers. We love to work with all social workers in different countries, but of course, a very special relationships we have with our countries which we were part of one country one time 30 years ago. So thank you very much for bringing us together.
Thank you. Wonderful discussion. So let's come again. You could see so many comments coming, and please share with your network so that our Russian friends from Belarus, Tajikistan may join and put their comments. So you may share the link in Facebook. That would be great and easy for them to communicate us and just put their valuable comments. So let's come again to Elena from Belarus. Our topic today, practice setting of professional social work in the post-Soviet countries. So, you know, in Asian, some countries, even in Bangladesh, some parts of India and other countries, social work is not a profession, but it's being taught in university and colleges as an academic discipline. Students are being produced, are being graduated, and after that, they're just being diverse. They're engaging in diverse field in different sectors for their job. But just they are forgetting their own discipline, mother discipline, that is social work, rather getting professionalized on that part because of the national or the state recognition due to the policy of professionalization. So I just select the topic, practice setting of professional social work in post-Soviet countries. So Alina, could you share something like during this pandemic and before pandemic, and actually how social work as usual as a profession works there in your country, and is there a specialty you find during this COVID crisis? Social workers through the association, the sufferer in disturb করছে অনবরত. Alina, please.
Can you say again the last? I didn't catch it.
Okay.
Their clients.
It's okay. I'm just telling you a few words. As a social work professional, social work association and organization, as usual, year-round, they do many things for the people, for the sufferers, for the suppressed people in the community. But how they are working there, normal works, and during COVID, what are the special things that you do there? I mean, from your organization, social work association in your country, Belarus.
Oh, okay. Well, actually, if to talk about the social workers profession, I can say that Belarus has a really long history of professional social work. We started probably 30 years ago, and I think we still at the beginning in some points. We have a state social system, And of course, during this COVID situation, we faced a lot of problems. We understood that we have a lack of NGOs and normal roots organizations that could provide some support for government and provide support for governmental bodies to organize this social work at the local level. Because we have, of course, we have a state social system. It includes around 200 state social services, but if you talk about these situations as with COVID, we understood that it's not enough, and we still need a lot to do to develop a community-based system in Belarus. We still don't have it, and now we understand that we need to work in this direction. That's why our association, we started some different directions. We work with the specialists, trying to explain them why it's important to organize and to work at the local level, to organize an activity of normal people, to motivate them to join together, to put together their efforts to solve some problems. So we work with the specialists, we work at the local level with initiative groups, we work with the self-help groups. We try to get support for organizations providing social services, not only governmental, but also for non-governmental organizations. Try to help them to find some financial support from government, from different international foundations. And if we talk about this problem with COVID situation, the biggest challenge was, of course, for closed institutions, especially for those where people with mental health issues live. And we understood that we really need to change, to do a great reform in Belarus in this direction, since a lot of people living there in this long care institution, they was really in a great they faced let's say they faced a COVID situation first, and we had the same as in other countries, we had a lot of people living in this closed institution. They those who got COVID first, and now we try to. Our association, we work in two different directions. We try to start a process of deinstitutionalization in Belarus, in a partnership, of course, with other organizations, non-governmental organizations, international organizations. And in the same time, we are trying to build this community-based support system for people living with severe illness, not only with mental illness, but some other kinds of illnesses. And we already put some good examples of community-based rehabilitation services, like clubhouses model, which is really famous across the world. And we try to move all this activity forward. We also work with the mental health institutions, medical institutions. And we understand that we need to put all this together, different system, because right now we have two different systems. One of them is a medical system, and in most our social services, I would rather say that we have a medical model, not ecological model, and we try to put them together to make them discuss all the questions and try to find problem solvings together, like medical institutions, social institutions, NGOs, and the community all together. So we also do different types. Right now, we can't organize it, of course, because of this COVID situation, but in last years, we organized a lot of activities like open space conferences, where governmental bodies and different kind of organizations and people at the local level could join together and discuss what to do at the local level, how to organize social support service for people, and how to decide the actual problem which is really important at this city or this region. And we also do...
Thank you. Alena,
right.
Just one thing for you. There is a question. In Bangladesh, social work is not a recognized profession. We don't have certified social workers. So what about post-Soviet countries? So what about actually Belarus? Is there social workers are certified like medical profession that you mentioned actually? Are they certified?
I would rather say we have a system a bit close to European. I mean, if we are talking about the high level of social work, that means that a person should go to the institute and get a profession, and we studied it during the 5 years. And then you have to get a diploma, but it's a bit different because after you have a diploma on social work, it doesn't mean you can't work until some kind of certification with a special system or with a special professional system. But we have different level. If we are talking about the social work at the lowest level, you don't need any special education to provide services for people. If we talk about planning social programs and developing social services, that means that you need special education and you need some years of experience to get this position, for example. But we still don't have, this is a great issue because we still don't have this system of certification as, for example, in the United States or in most of the European countries.
All right, thank you, Elena. Thanks for a wonderful discussion. I will come back to you again. Just let's have some sharing from Umeda, Tajikistan. Umeda from Tajikistan. Umeda, could you hear me? All right.
Yes, I hear.
During this time, I mean, over the months, especially during COVID time, that we could see, beside government is rendering social services through its social welfare ministry, social service department, through some safety net programs. Many organizations, those who are actually development organizations, they are doing work for the people. Some people, rich class people, they are doing charity. People like us, those who are not actually financially capable, so they are putting hands together, just standing beside the people just to help them, because there are, categories of people. There are working class people, there are industry laborers, there are agricultural laborers, there are so many variety of people, and this time many corporates and employees lost their job, in many countries of the world. So it's a big hassle and big problem. So around your community, I mean, out of your organizations, how you are participating, or you were just observing that people are coming together or people are doing surveys, especially the social work organizations doing charity services and helping hands together during this COVID. Umeda, you can carry on, and Eka, you can just retranslate it after her delivery. That would be nice, I think.
Умеда перевести, да? Я надеюсь, что я перевожу правильно на самом деле. Вопрос был в том, что понятно, что во время ковида было очень много проблем, да? Например, одна из самых ярких проблем – это как раз потеря работы, ну и прочее. И ему интересно послушать, каким образом социальные группы, социальной кампании, они могут быть правительственные, могут быть неправительственные, как люди объединялись и решали эти проблемы, да, на своем локальном или на своем уровне. Алена, did I understand it correctly? Yes? Okay.
Нет, хватит, достаточно, да. Ну, спасибо большое за вопрос. Я буду очень коротко отвечать.
Thank you for the question. I will answer shortly.
Конечно, пандемия COVID-19, она представила из себя очень большое испытание для нашей страны и вообще для всех стран в мире.
So COVID-19 is actually a big challenge, not only for our country, but for everyone in the world.
И она выявила все недочеты, минусы системы, как системы здравоохранения, так и системы социальной защиты, трудоустройства и вообще реагирования на такие чрезвычайные ситуации.
And it disclosed all the drawbacks, all the minuses in the system, not only of healthcare, but also social system and other governmental structures.
Ну, на примере нашей страны я могу сказать, что эта беда, она очень сплотила всех нас. Она помогла мобилизовать все ресурсы за кратчайший период и справиться с этой пандемией хотя бы на начальном этапе, вот на том этапе, на котором мы сейчас находимся.
But if I take as an example my country, this coronavirus, this pandemic, actually united the whole population. We used all the resources in order to fight the problem, in order to cope with it.
Как я уже сказала, у нас не было введено карантина, и все предприятия, они продолжали работать в обычном режиме.
As I already said, we did not have the quarantine applied in our country, so all the factories, all the companies continued working during the pandemic.
Это привело к очень большому количеству больных и зараженных людей в стране.
And as a result, we had a huge number of people infected in our country.
И в таких условиях, конечно, система здравоохранения не могла справиться самостоятельно. На помощь пришли все секторы, которые были так или иначе связаны с помощью людям, которые пострадали от COVID.
In such situation, healthcare system could not cope on its own, and that's when all the sectors that were somehow connected, that could help in this, they came to help.
В первую очередь отреагировало гражданское общество и международные организации на эту беду.
The first one to react was the civil society and the international organizations.
Гражданское общество по собственной инициативе стали собирать средства и помогать наиболее уязвимым группам населения. Это люди с инвалидностью, одинокие престарелые, люди, которые остались без кормильцев, без средств на существование.
Communities came to help. They were collecting money and trying to help in such particular cases, like with handicapped people, with people who live on their own, people who were left without any resource to live, without any money, without jobs.
Потому что очень много трудовых мигрантов у нас были в Российской Федерации, которые в одночасье лишились средств или заработка и перестали помогать своим семьям.
We have a huge number of people who came back from Russia, who usually work and have jobs in Russia, and they came back and could not earn money, could not sponsor their families anymore.
Да, и вот первыми отреагировали это НКО, неправительственные организации и международные организации, которые организовали экстренную помощь населению и медицинским работникам.
So the first organizations that reacted were the NGOs and international organizations that provided help to those urgent, acute needed people or groups of people.
Хочу отметить, что социальные работники не переставали предоставлять услуги своим клиентам. Они продолжали оказывать поддержку с помощью телефона, дистанционно, и продолжали посещать семьи, несмотря на трудную ситуацию с пандемией.
The social workers did not stop working. They were still going, doing the home care, visiting people or helping them on the phone, providing some advice or support, psychological support.
Они продолжали предоставлять информацию о профилактике коронавирусной инфекции, куда следует обратиться за помощью, как это сделать. Они стали вот таким связующим мостом между системой здравоохранения и местным сообществом.
They were also informing the population on what measures to take, on what is the real situation, what to do. So there was this linking bridge between those who stayed at home and the society, the world.
Особенно это касается уязвимых групп населения, это престарелые, одинокие, люди с инвалидностью, которые самостоятельно не могли решить эти проблемы, даже проблемы с госпитализацией или медицинской помощью, то есть медицинской помощи.
The groups which needed help the most were the people handicapped or the elderly population who could not find solutions to their problems themselves. Or, for example, people who needed to go to hospital. So all such groups who usually need some external support, they got help from those NGOs and international organizations.
Также социальные работники помогли сформировать группы самопомощи на уровне комьюнити. Они объединили всех волонтеров, добровольцев, которые хотели помочь, и смогли направить их усилия в правильное русло, то есть адресно, целенаправленно оказывать эту помощь.
Another direction of social work was to unite volunteers, to guide them what to do, to organize them, to make this logistics in order to provide the direct help to the households.
Конечно же, правительство тоже очень большой вклад внесло в борьбу с коронавирусной инфекцией. За очень короткий период были развертаны стационары, дневные стационары, ночные стационары, временные стационары. И была оказана помощь, материальная помощь людям, которые попали в трудную жизненную ситуацию, остались без средств существования.
So the government was not idle either. Of course, they've been built shortly built the residential houses which could provide help only for daytime or only for nighttime, or to provide some support for those who got into trouble in such situations.
Но вклад социальных работников как мобилизаторов сообщества трудно переоценить. Социальные работники наряду с медицинскими работниками все время были на передовой борьбы с коронавирусом.
Of course, the input of the social workers was really great. They were fighting, they were working as hard as the medical workers. They were always front, always ready to dive into the problems and help.
All right, thank you, Umeda. Actually, a very good discussion. And dear viewers, that I should say, this is community talks. This is a global community talk. So when our friend speaks Spanish, French, and Russian language or other language, we feel really very happy because this is an exchange. This is a reciprocity among the friends of different parts of the world. So, Umeda, special thanks to you to use your own language rather than English, because this is a very fantastic session that actually Eka retranslated it. Thank you. I'll come back to you again. Let's come to Antonina, Honorable President, Russian Federation, Russian Union of Social Worker and Social Pedagogists. And Antonina, just before coming here, I have some questions.
Yes, please.
As social work in Bangladesh, as it's not profession, but so far I could see, understood from and share from other friends of other countries that where the social work is professionalized, there is a question of licensing. And before coming to that license, there was a training system, getting membership, procedure of membership. And you are leading such a big organization in the world, I think, in Russia, huge number of members and very renowned, successfully working. So when the number is a bigger one, it's very difficult to manage. So how you actually doing and leading this organization as an honorable president? And if you kindly share us something, overall procedure of your organization through training, that would be, I think, a great help for us to know from you. Antonina, please.
Okay, Habibur, can I first, there was a question there, yes, about licensing, but before, when I was preparing myself for the meeting, I contacted the Dean of Social Work faculty of Russian State Social University, and I asked her about training of social workers. Of course, number one, at the moment in Russia, we have more than 150 social work faculties. It's to the question you ask if the profession is recognized. Yes, in Russia, profession is recognized, and in 150 faculties of social work, we train professional social workers. They study for 5 years, and after 5 years, they come to be a practitioners. We call them specialists in social work. You probably know, some of you, that just 1 week ago, we have published, we have approved the new standard for social services workers, for social workers who work in the field. So yes, our profession is recognized and our profession is well established, although we are quite young. We are only 30 years of old profession. The dean of the faculty of this very big institute, which has branches in many regions of Russia, said that there is one problem now. Last year, for students who want to become social workers, there were 17,000 of budget places. It means that 17 students could study free of charge for 5 years at only one university with branches. But now the amount of people who have the chance to study free, it became twice as less. So we will see what will happen. Will it not bring more students together to our profession, or what will happen? But you can understand that government spends a lot of money to train people. One more problem, which I think we have in Russia with training institutions, they are not members of association of schools of social work. And it's big international association of social teachers, association of schools of social work, where Russia is not part of. And of course, it's very, very important to become well advanced, well developed. You have to be part of the international community. So I hope very much that we will have Russian schools of social work, faculties of social work, members of international association. We invited Anna Maria Cavaloni, president of International Association, to Russia. She came to Moscow, she came to Vladivostok with us, but we don't have this. So this is one of the thing. And I think for Bangladesh and for any other country, it's very important to be part of association. As for Union of Social Workers, you know, it's difficult, but not terribly difficult, because social workers are quite well, because it's an established profession, because people want to be involved, because people want to be part of international community. They're interested. We do have branches in 45 regions of Russia. Not every person is member, but quite many of them are. So it's just difficult job, but it's very important. But talking about training, we do not have license. We have a diploma, university degree. This is our license to work. But if the person graduated 10 years ago and the profession is developing so quickly, they need to raise qualification. And I'm very happy that we have Institute of Social Work Training raising qualification from Moscow, who will tell about this, because they universities work with students, but they work with mature social workers. And in Russia, I think it's a great breakthrough that we have several institutes of raising qualification, not in each region, but I know Khanty-Mansiysk, Irkutsk, but Moscow Institute is one of the strongest bodies for practicing social workers. And if Habibur, very kind, maybe he will allow a representative from the institute, Ekaterina and Anton, to speak. But he is leading, I don't know. Okay?
Yeah. So, Antonina, will you speak more later so I can come to...
I finished.
Okay.
I just thought that it's absolutely correct if Ekaterina and Anton will explain how practitioners come to raise their qualification to make it more advanced.
Right, that's great. So I should come to Anton and Ekaterina, that the questions of mine and questions of Antonina, just from your side, how institution or institute that you are doing or leading there. So both of you can actually collaborate this and answer this. That would be great, I think.
You start.
Thanks. About our institution, about our system in Moscow. We have common post-Soviet history, and there are, in our country we have 89 regions. It's a very different region with law, social law in every region, different rules to work, but we need to have professional education. If you have now social education, you can go to the institute, our institute,
University
institute, and takes some skills, take some social skills, take some professional skills. In our institution, we have, I think, 200 students every year, or more.
Well,
in Moscow.
It depends on the courses. There are long-term courses and there are short-term courses, and the education is going on even during the COVID. Of course, during this time, during the 4 months, we were only providing online courses, but everybody who was studying, who was attending regularly the courses, now can come up into real classes, take a few more trainings, and actually get the certificate or certificate with the upgrade of the education.
My institution take some video courses from institute to medical workers, to social workers, to manager, and I think it's really interesting. It's really important in our work, in our professional.
Mm-hmm. And yeah, it's quite continuous education. There is quite a variety of courses, and besides, if some social place, some social institution, not only from Moscow but from the regions, they
Антон, вы замерли. Антон, что-то у вас там не в порядке. Антон. Антон, Москва.
hasn't been. Are we back? Did you hear?
Okay, carry on.
So we've been, I don't know at which point you've lost us. Well, anyway, I wanted to say that
online courses you are providing and videos, right? Providing for the students during COVID. That's actually.
Yes, so the education continues, and every day we have, well, there is at least 3 online classes going on, and we have restarted the real classes right now. So during, there are people, social workers coming to our institute every day and getting courses just right here. As I said, organizations not only from Moscow but also from regions can request special programs. For example, they feel like they need staff to be trained with first primary help, or with rehabilitation, or with whatever. Like we have a huge, yes, a quite important course going on mediation right now. They might be focused on children problems, or might be focused on problems, some psychological problems, family. Well,
it's really important that our institute can take to our institution a lot of solution. The structure solution is instruction solution, a lot of. We can speak about problem. I think it's the most problem is COVID-19 reality is a fear. In our institution is a fear. People don't know anything about this, and we can speak about it. We can take some experience from you, from our friends in our institute. It help us. It help us a lot more.
Well,
so it's very, very important to us.
To unite, to understand, to share information, to exchange the information, and also to brainstorm also for the future. Also, you know that like just last month, new standards of social workers have been applied. And before they've been developed, there've been lots of studying going on also inside the institute. So some staff was working on that and then went to department. So I think it's a huge tool, and yes, it's possible to cooperate together and to exchange. I personally work in the Department of International Exchange, and I would like to stay in touch also with our colleagues from former Soviet republics, because we do have requests from our deputy minister to visit. Yes, we actually planned to visit to Belarus this year, if in case of if COVID didn't happen. I guess we would be visiting. we do plan some international conferences this year still. And I hope when the situation normalizes, when it comes back to, we come to our normal life, we will continue our international exchange, which can be both sides. Like we had a group of German specialists coming to Moscow to study our system, and we also have lots of Moscow groups going abroad to study how it is working, to study some innovative processes abroad.
Now, and I think now we have a chance to make an international international partnership with with other countries, with other people, with other professionals, and we need it. In Moscow, we need it.
Mm-hmm. Actually, this COVID experience also gives lots of chances, because it opened the online platform, and this way we do exchange information, like in this, like right now we are doing much more than we have done than we did last year.
Right.
Yes, it's faster. It is actually more efficient, but of course, like there should be also point of real visit and touch and.
Right. Thank you, Ekaterina and Anton. Actually, I'll come back again.
You real visits more.
Yeah. This COVID situation has created so many problems, but so many opportunities in that case, right? I think, I do believe, because this time the platform that we are doing, and there are so many webinars around the world, seminars, conferences, having and meeting. So it's actually, it's not even physical distancing because we are sitting beside. So it's a very close connection through this platform during this COVID. And before COVID, actually, we didn't think like this. We didn't do Zoom meetings, we didn't do Messenger, Facebooking, and other Google Meet. We are just currently this time as a best alternative and opportunities of the COVID that created for the human civilization around the world. We have been using, and social work, so far we do believe and we understand this is a composition of so many other knowledges of social science, even in sciences, when we are dealing with the problem in people in problem in the community. So this platform, Community Talks, initially I thought this is just time passing or like that, but I had a long goal that I can invite so many other friends just to share their knowledges, because in this time it's very difficult to visit other countries, and I have a passion to visit, to attend so many conferences. I just tried this year. I had a plan at least visit 4 countries, but after visiting one country, it stopped me. This time, that's why virtually I have been visiting many countries and seeing so many friends, how they are passing their time and taking the challenges as opportunities that Antonina said, and you also mentioned that social workers are the warriors. They are the fighter. They are the fighter even. They have a tremendous soul. They have a very strong mind, motivated and self-startup mind just to fight against any kinds of problem and challenges arise in the community. So let's come to the points. Actually, people are commenting on the inbox here, giving me messages, and here also they're putting live comments. Friend from Argentina, Vladimiro, joined us. Friend from India, Dr. Shakti Prabha joined us. Friend from Philippines. Friend from Singapore, Professor I found Honorable Professor Norton Tiong from Singapore watching, and so many other friends watch this show. And after the session, even they will host this watch party, just have some interaction through this virtual platform. So I find some good side, especially this digitalization through the emergence of COVID-19 as a big challenge for the human civilization. So as a social worker, I think we are the best person, we are the best group to use this positively, because we have some counseling trends, we have some counseling qualification that definitely be held through this online platform. So let's come again. Actually, this is the last 2 or 3 minutes, the last talk session, as already 1 hour and 10 minutes over. So another 20 minutes will be on the show. Let's come again to Elena from Belarus. So what are the suggestions for us from your side for the frustrated young people, for the students, for the young uprising social workers around the world? Because this time this is actually a frustration for everybody, but we are trying to be self-motivated for some reasons that we have to survive. We have to fight against this COVID. So, Elena, what is your voice for us, for other friends around the world to keep fit and healthy and properly immunized during this COVID time?
No, first of all, I would like to say that now we understand, actually, I think the whole world now can understand what is the role of specialists like social workers. And I can hear it in different points. People talk not only about medical specialists as it was before, but now people talk about social workers. And I would like to say to everyone, even for in your country, even if it's not a profession, still, I mean, not everyone can recognize it as a profession. Social work in many countries started from the community, started from joining together people who like-minded, who would like to change, make some changes in the community. And you are already actually strong to make all these changes, even without any different kind of licenses or certifications. You are already have, if you have a passion, if you have your open mind, if you have different ideas how to change, you can start moving forward. But of course, you have to remember, as a specialist in social work, the professionals, you are responsible not only for people, not only for the clients. You are first of all responsible to stay in safe for yourself, because all those people depends on social work, depends on specialists on social work. And first of all, everybody, I mean, every professional, they have to keep in safe not only health, I mean, like in general, but also especially in this COVID situation, we have to keep our mental health in safe. And I have a great suggestion for every specialist to apply for help if you need it. Try to find different groups of specialists who can discuss with you and who can help you to organize your work if you don't understand, for example, right now how to change it and how to provide it better for the clients, for people you work with. Because supervision is a really important part in social work, and support from one specialist to another is really important. It's really hard, of course, to face all these problems alone. And if you have a possibility, and especially if we are talking about this time, all these online platforms, they are, as already you said before, it helps us to grow our work and to communicate with different specialists from different countries. Don't hesitate to ask questions for specialists from other countries. If you need help or you need some examples or advices how to organize your work, or how to start something, or how to move forward in your ideas, don't hesitate to ask. Because I know that especially in social, if we are talking about social work, people usually come here if they have really important characteristics like empathy and open mind, and they are really open. As I have really long practice of communication and work together with specialists from different countries, especially from Russia. And Antonina will also agree with me. I think that it's really important to discuss different really hard solve problems, topics discussed, and try to find a way how to come over this together. And all these discussions are really important also, not only for professional, but also for saving your mental health as a profession, because you are really responsible for yourself.
Thank you, Elena, for nice briefing. Let's come to Anton and Ekaterina. This time with the social worker, with the problem solver. So always try to solve the problem, and COVID has created so many problems together for the social worker. So I do believe this is a big chances for the social worker to be concentrated on that part. So what do you think, what kind of teaching already raised for the social workers, students around the world? I mean, education for the upcoming social worker from your side.
Well, yes, I wanted to add, or actually I wanted to develop the idea which I was talking about, but I actually didn't go into the essence. Like during the COVID time, we've been actually hiring lots of people. Well, they needed job. Yes, there were thousands of people who lost their job, but at the same time, we needed those people in the institutions, in the hospitals, helping medical staff. And for most of them, it was like a start into social work, right? Like the primary start to help to be the nurse, right? And to some extent, being this help is what we are used to. So most social workers, most social staff that provides help at home, they are not educated people, right? But this is what, at least our department and our institute is working on, is to provide education. This primary education to people who would like to be social workers officially, to provide primary skills for primary care. Help me if I'm if I'm lying, if I'm not saying if.
I think it's something new in COVID-19 reality in our country. A lot of people can do something, can do new things in social work. They know about social work. They live in another life, in other rules, and now they know that we have a lot of people who need help, a lot of people who you can help. You can come into institution, come into a department and say, yes, I want to help the people, and to take their education, see new people, take new friends. I think it's new. It's a real important, real new page in our history. We can change all the system. We can do provide the very important things. And now we have in our system come many people, many new people, and I think it's changed something.
As Alena said, yes. Well, first of all, in order to come to this profession, you do need lots of personal characteristics like empathy, like the will to help other people. That was actually one of the one of the measures. Like when we were hiring those people, why would you want to work there? The second was that they did have this experience before. For example, they took care after their elderly parents or relatives or somebody else, so they already practiced that and they understood that they can do it, that it is not something really hard, that they are strong emotionally, and it's also a rewarding profession, right? Probably not rewarding, I don't know how financially it is rewarded, but of course it is emotionally rewarding, and you understand that you actually do something, you makes other people's life better. So that was the second thing. But the will and some experience is not enough. That's why if you do need some professional, if you need to know the legal part of the profession, if you want to study some real technical skills, you can come to, well, our institute, for example, and to apply to a course and get a certificate and be officially become officially a social worker. Also, during the COVID, there have been lots of volunteers who providing this help without money, but again, they've been testing themselves, and I'm sure that, or at least we do have statistics that there are lots of students coming into profession as well, not directly from social institutes. Yes, they've been studying, well, to become lawyers, to become engineers, to become, well, teachers. Well, it's good if they wanted to become doctors, but they decided to shift their professions. But in order to make this shift, it is possible to make it legal, you know, and get the certificate by going through a course. Thank you.
That's great. Actually, thank you. Actually, that is my point. Even if you didn't discuss this, I will ask you that there are few people in my community, like category people are, I mean, students are graduating from social work and somebody engaged in teaching. They're different category, but other people are, they didn't have that social work academic knowledge, but they have a good heart. They have a sympathetic mind. They have empathy. They love to do work for the people. So that is the concern. People having social work degree, they sometimes, some cases, they are not coming in the field. They are keeping them in other professions as social work is not professionalized. They are keeping inside of the classroom. They are not coming in practice. But other people, those don't have that degree and knowledge, but they have the real heart for the people. They love to work for the people. So that you mentioned last day, Eka and Anton, that was actually my queries also. If you didn't mention, I ask you definitely, that they have some training or they have diploma courses. And after that, they'll come to the real field of social work, transferring from their real previous profession. Either they might be doctor or engineer, because it depends on the sympathetic and good heart, in fact, for the charity and well-being of the society. Very good. Actually, that was the real point. So let's come to Umeda, just for last 2 minutes talk. You were doing job in Kyrgysthan, Germany, representing Tajikistan. What kind of job and activities and efforts and supports you were giving for the people on behalf of your organizations, or if you were engaged in social organizations there, just in a brief, Tilly, that you love to say and share with the people right now.
Is it a question to her directly or to the community, the Tajikistan community?
Yeah, the Tajikistan community, she may highlight. That would be nice, I think.
Ну, вопрос на самом деле, приведите, пожалуйста, примеры, какую именно помощь оказывали вы, ваше сообщество, людям, которые нуждались в ней.
Спасибо большое за вопрос. Ну, так как я представляю международную организацию, являюсь координатором программы реабилитация на уровне общины, то основной фокус нашей работы был направлен на людей, которые живут в отдаленных местностях, далеко от центров, от городов. А также в связи с пандемией мы оказали помощь непосредственно медицинским работникам, которые отдалены, находятся далеко от столицы. Помощь оказали с этими средствами защиты, индивидуальными средствами защиты.
I'm representing an international association of social workers in Tajikistan. So our real work, the examples of our work were we were supporting people who live at a distance from the centers, and also medical personnel, doctors who are distant. For example, we were providing the individual
Protective.
Yes, protective clothing or
PPE.
PPE.
It's PPE.
a personal protecting
Personal protection equipment.
Right. PPE, right.
Так как мы обладаем информацией, сколько нуждающихся есть в отдаленных общинах, в чем они нуждаются, мы смогли очень быстро отреагировать и вовремя помочь как местному населению, так и медикам, которые оказались в такой вот трудной ситуации. Это было очень быстро и своевременно.
Since we had the data of how many people and where needed our help, we provided this help in time. So, and it was just the best to do. So there was no real crisis at those places.
That's great. Thank you.
У меня еще что-то, если
да,
есть?
Ну и, конечно же, вот информация, это то, что не хватало нам в первое время, информация о профилактике, как предохранить себя от заражения, что нужно делать, чтобы выжить в этих условиях, это тоже было очень важно. То есть вот своевременное предоставление достоверной и нужной информации населению, и особенно группам населения, которые ограничены были в доступе. То есть это люди плохо слышащие, люди, которые плохо видят. В доступной форме мы смогли передать информацию и очень вовремя, своевременно.
One of the urgent things which we were lacking was the lack of information about preventive measures, especially to the groups of people who needed it, like to people who are challenged, visually challenged, or they impaired. In some other cases, they needed the real information, what they can do, what they can't do in the time of pandemic.
All right, thank you. Thank you, Meda. Actually, we are running after time, so last 2 or 3 minutes, I'd love to listen the voice from Antonina. Actually, she is a real inspiration in this profession. So far, I could go through her profile and just try to know about her. She is that person. She is representing Russian Union of Social Worker, and she loves to be identified as a professional social worker, as a practitioner, rather any other identification that she has or she deserves. I salute her really. This is the spirit of social worker. As a social work graduate, that I love to do. In last two session, I declare to Honorable State Minister and Honorable Secretary, Senior Secretary of Ministry of Social Welfare, that as a social worker, as a social work graduate, this is my passion to be a practitioner, because I love to do practice with the people. The knowledge I love to transfer with the people. But if I change the direction after the graduation, after master's, MPhil, PhD, or other knowledge in social work practice, if I do any job in corporate sector or other sector, these sectors are okay, but this is, I think, will be meaningless for me if medical professionals come to these other professions like in administration or other parts. So I think right man should be in right position, and social service may be developed, may be properly executed and ensured if social work graduates actually might be promoted in that part in particular, so that their empathy, their sympathy might be acknowledged, their performance as a good manager, as a catalyst, as an advocate, as a lawyer in that case, as a good leader might be properly implemented in social work field if they really come to that field having their identification, as my question equally pronounced everywhere, all the platforms, till the identification, who am I? My question was in different platform, who am I? before coming and clarifying this identification as a social worker, it's very, very difficult really to take place in the community among the people as an recognized someone, as a trustworthy someone. So it's sometimes it's really needed. That's why we're just working on that. So last, I'm coming to Antonina. You are leading such a big platform of social workers. So could you please share in a few words how you are leading and how many like organizations, sub-organizations, institutions, those who are working in school social work, mental healing, other parts like, so could you please share something in Russia, how you are actually managing all these such a big organizations there, Russian Union?
Habibur, you asked me again, how do I manage? With difficulty, but with great pleasure. It's really difficult job. Can you imagine in this huge country to motivate people, to try bring people together? But events like this, like which you organize, also help. Everything helps. You know, we just work together. We try to support each other. I wanted to say that Union of Social Workers is a member of International Federation of Social Workers, and we have many friends in many countries, and it's Philippines and Vietnam and Singapore and Hong Kong and Chile and United States. But we're also members of International Association of Social Pedagogues. And it's an organization not as big as IFSW, but also quite important big organization. And in Social Pedagogues Association, they have a slogan, what is the best profession in the world? And they will always say, social pedagogue is the best profession of the world. But it's very difficult for me, because for me, social work is also the best profession. So what we have to realize now, the coronavirus helped us. It sounds terrible, but it helped the profession be more stronger. And COVID-19 raised profile, prestige, and status of our profession. If before, even in Russia, being in the taxi, being in meeting people who are not social workers, I was asking, do you know what social work means? People don't know. And but now everybody will know, because social work is now in the front line, as we say, as Ekaterina said, or Umeda. We are on front line, and we demonstrated how strong we are. But there is a danger, and I want to warn, as a professional with very big age and very long experience, we should not let profession to be undermined by volunteers of NGOs. It's different. We have to understand there is a profession, social work, and there are a huge amount of interesting, fantastic people around us who will never become social workers. They have to be trained to become social workers. To become social worker, you have to go for 4 years to university. You are taught how to touch the person, how to comfort the person, which words to come. So what I want to say, maybe my colleagues will not agree with me, but a wonderful heart is not enough. So COVID again showed us that profession will be stronger when we talk about profession, not mix up everything. It's not a porridge of everything, everybody. We have social workers, we have wonderful volunteers, we have wonderful non-governmental organizations where some social workers work, but it's different. And if we mix everything, it will be not very good. But just my last message, I'm watching the time, my last message is that international social work is a priority for solidarity, for understanding, for strengthening profession. And I'm very proud of myself looking at Umeda, that being in Uzbekistan and suddenly receiving invitation from Tajikistan, I dared to go via Pamir Mountains in the car on my own to visit them. So I wish all of us be mobile, strong. And can I ask you, what is the best profession in the world?
You asking
I
me?
ask everybody, what is the best profession in the world? Doctor.
Of course, social work.
Oh,
Social work is the
social
best
work
profession.
is the best profession in the world, and we have to repeat it all the time, and we have to have it as a slogan. And then because we really fantastic. So thank you very much for my lovely, dear friends from Institute, which I love so much, and Belarus, and wonderful Tajikistan, and of course Habibur, who is absolutely fantastic and who is absolutely real social worker who tries to do his best. Everybody has to try to do something important for the profession. So thank you very much.
Thank you, dear Antonina and other my friends from different countries. Actually, my passion just grew up when I met some social work legendary professor practitioner in different conferences, and I asked Ruth Stark, immediate past president of IFSW, in a conference in Bangkok, Thailand, how many years might it be taken to make social work as a profession in my country? And she directly told me, Habib, how dear you are. In Scotland, it took 19 years to make social work in a professional status, but still it's not highly working. I declare in that stage, if things are okay, then I can even dedicate my life for the social work profession, because I just grown up on that academics knowledge of profession. So I want to live with that identification. I am a social worker rather than any other identification. That I'm a doctor, I'm a physician, I'm an engineer, or I'm a businessman, just rather everything. I love to be happy if I can show me as a social worker. That actually Antonina wonderfully lastly mentioned, people might have definitely a good heart for charity. Actually, this is the last word. I really appreciate this, the words. There are so many people, I didn't disagree with that people. It's really needed for changing the community, for making community resilient, making community reliant and sustainably developed. But matter is, profession is, even after all these things needed to make people identify properly. And there is a profession that Ekaterina nicely mentioned, that there is a courses diploma, there is training provisions. People from other discipline, even after having this training and courses, they might change their profession. They might wholeheartedly work for the community development and changing the community. So there is no confusion in that case. People coming from or graduating from social work or other discipline, they equally can be treated as a professional if really chances are there and professionally or institutionally grown up. So my community talks as a passion that Antonina mentioned. I find no other alternatives. I have actually nothing. I'm with a laptop, with my mobile phone, you say, network doing, just creating some problem automatically, but I'm very passionate social worker. Before my death, I want to see social work in a position because I love it. And all social worker equally should raise the voice that Antonina mentioned. What is the best profession ever in the world? I must say, we should say social work is the best profession, because social worker are the good manager, social worker are the vocalist, social worker are the manager, they are the motivator, they are the advocate, they are the lawyer. They have all kinds of knowledges together, I do believe. Because when I talk publicly with my colleagues and friends, they impress. If I think, I just definitely try to make them emotional. They are becoming emotional. When I am an administrator, I can properly manage everything. in my university, my honorable Vice Chancellor, sometime and other also leaders mentioned, when you talk in the platform, I don't think something different, but I'm not sure why I became impressed. What is the secret within you? I just told them directly, I just have some good hearts that a social worker has to have. That's why might be my face or my voice or my notion of talk might impress you. Nothing else really. So my request, the followers and friends, so many friends join. Actually, it's very tough to mention your name. Please do come together in your own community. And though we know charity starts and charity begins at home, we should start our own school and own community, putting hand together. Then the whole world, Antonino's dream, our dream actually might be definitely true as the best profession in the world, social work. So I'm very delighted and happy to have you here all together. Umeda from Tajikistan, Belarus, from Belarus, Elena, and Russia, and Anton, and Ekaterina, and Vadim. Actually, Professor Vadim, we miss you. We really miss you. You are supposed to be here today. And Antonina, credit definitely goes to you because you're such a busy man, rather other person, but you give me so many time to connect people actually. It's a fantastic platform, and social worker would be so really to be communicated each other so that global social work and your concern, international social work might rise future, hopefully. So this is the last, we can say goodbye together to our audience and friends, those who are watching and who will do.
До свидания, до свидания, до свидания. До свидания. Да, до свидания всем.